Let's begin. When we talk about this thing, overview of fungi doctors, you should know, first of all, two things. Fungi are made out of either yeast or molds. Okay, yeast or molds. Now, that's a very important thing. Only two main types of fungi. Others are derived from these categories, like yeast-like or the dimorphic, as you're seeing here. Now, yeast, I told you, yeast ka important feature is they reproduce by budding, right? So basically, a baby is formed like this from the parent, right? This is a bud that was formed. And what you are supposed to know is after some time, this baby will detach itself from the parent. It itself has now become a parent. Another baby can arise from this. Again, that guy detaches itself. That is the true budding as such. Okay. So this is what that you need to know. This is one example. Yeast is Cryptococcus neoformans. Now, look at the word yeast-like. Yeast-like organism. It's not a true yeast. It's somebody like a yeast. Now, see here, again, it also is doing budding, hence we call it like yeast-like. But the point with its budding is the bud doesn't detach itself. The bud doesn't detach. Rather, the babies that are produced, they keep attaching to their parents like this, and it ends up looking like something called as a hyphae. But these are not hyphae, that's actually buds. They're looking like hyphae, they're not buds. That's why the name is pseudo hyphae. Pseudo means false hyphae, and pseudo hyphae formation is an identification of Candida albicans. Previously also, this was also budding, this is also budding. But what's the difference? Here the baby was detaching itself. But here the buds are not detaching themselves, they're just continuing over here like this. That is what is called as pseudo hyphae. Done. Okay. Next, molds are the ones that forms the true hyphae. Okay. Molds are the ones that forms the true hyphae. This is what you need to know as such. Example, dermatophytes, mucor, aspergillus. Okay. These all come under the true hyphal forms. Done. Dimorphic fungi. अब इनकी कहानी क्या है? Listen to me. Dimorphic fungi, they were existing as two forms. Dimorphic, they exist in two forms. What are the two forms right now? Yeast also, mold also. But when are they going to change their shape, etc., based on the temperature? When they are outside the body in the environment, etc., they are in mold form, and when they come in human body, they change it to yeast form. Okay. Now there is one mnemonic: body heat changes shape pretty perfectly, that you have to look at later on. Anyway, when we learn certain appearances, you will know these points. Okay. Now, next thing is the spores. They have some names like, basidiospores, ascospores, etc. These are different families. Majority of the important fungi, pathogenic fungi, they belong to this family Deuteromycetes. Deuteromycetes is the family where most of the clinically important fungi belongs to. Okay, so these are, basically different sexual spores, etc. Next, moving on, let's look at identification of fungi. This is one stain that everybody should look at. This is the Indiang stain, very, very, very important stain for your exam. Okay, please know this is not for staining the organism, rather it is for staining the capsule of organisms. And I'm saying capsule of organisms, not only one organism. Now, in this topic, we are learning, because this is the fungus topic we are learning. The fungus having a capsule is Cryptococcus neoformans. And if you have at least a basic memory about this organism, it causes meningitis in AIDS patients. Okay, it is going to cause meningitis in AIDS patients. So that's something that everybody should know as such. Next, guys, this word is very, very important. 10% KOH, 10% potassium hydroxide. This is what you should know. This is the one that we use to prepare the slides for the fungi. 10% KOH is very, very important. for making the wet mounds. Okay. Next, one only culture media, Sabarods, dextrose, agar. So once again, what you should know, fungi are of two types, yeast and the mold. Yeast produced by budding. Now the bud may be attaching same and continuing like that, forming pseudohyphae, or the bud detaches itself like in the classical case of yeast. Molds are the one that forms hyphae. Molds are the ones that form the true hyphae. Okay. Next, as I said, Indian staining is for the capsule and culture media over here is Sabrods dextrose agar. Done. Now, Tinea versicolor. Tinea versicolor, the causative agent is Malassezia furfur. The causative agent here would be called as Malassezia furfur. And what you're supposed to know is this is the guy that is producing what? Spaghetti and meatball appearance as such on microscopy. Okay, banana or grape or spaghetti or meatball appearance. This is how it is described. All right. So that's about this guy that you should be knowing. Two words only, Malassezia furfur, spaghetti and meatball appearance. All of this superficial fungal infections we are talking called as tinea infections. They will be presenting with hypopigmented patches on the body. Okay. So that's about it that you need to know. Okay. Next. I'm just going to focus on the more important things, guys. Tinea or dermatophytes or ringworm infections. Okay, tinea or dermatophytes or ringworm infections. Now, what you're supposed to know here, first is trichophyton. Okay, tri is the word. This is how we had learned in classroom also. Three things are involved: hair, skin, and nail. Skin has to be involved because the name of the infection is derma. Derma means skin, right? So trichophyton, skin, hair, and nail. Epidermophyton, skin and nail. Microsporum, skin and hair, right? So you got this idea, hopefully. Skin is involved in all of them. The only combos that will change is trichophyton, all the three. Epiderm, remember it like this, outside layer, that is skin and nail. Epidermophyton, microsporum is skin and hair. Next, clinically speaking, we had given these names that tinea infections are having these kind of names, etc. here. Okay. So, for example, tinea capitis, it is the infection of the scalp. We had learnt it like this. There are two types of tinea infections again. One is this one, what we call by the name of, okay, Kirion. And this is the one that we call by the name of Favus. Scaly lesions. Scaly lesions are a feature of this guy called as Favus. What was the mnemonic? Psoriasis like. Favus has a S, and you should all memorize psoriasis like organism also is known as Schonleni. Okay, the organism to do this is called as Schonleni. And next thing is this, Kirion guy that you're able to see here. Now, what should you remember with the Kirion is this? See, Kirion, first of all, who's causing it? Tinea mentagrophytes. Okay, this is the guy called by the name of Tinea mentagrophytes. All right. Sorry, Trichophyton mentagrophytes. That's the name here because we are talking about these three guys, right? Trichophyton, epidermophyton, and then microsporum. So please remember, this is Trichophyton mentagrophytes. Okay. Now, if everybody is comfortable with what you just saw, just remember, this is one of the most common organisms in all these fungal infections. Okay. One of the most common organisms amongst the trichophyton infections or the tinea infections to cause all these things. Most of the places you'll be seeing this guy called as, mentagrophytes. Mentagrophytes. So it's overall one of the common organisms. Okay. Next, let's move to the identification part. Guys, this is important for you all to know now. Okay, this is the place where you should see these things. This microconidia or macroconidia, these are simply asexual spores of this fungi. Okay, they are the asexual spores of this fungi. This is what you should first know here. They are the asexual spores. Okay, now learn the thing one by one. Trichophyton. How many tissues were involved? 3, and 3 was the maximum. We are going to remember maximum tissue involvement is seen with this guy, and then maximum microconidia are also present. Are you getting my point here? Tri means maximum tissues and maximum conidae are present. All right. Next, epidermophyton completely absent. Completely absent. And in microsporum, micro word means small or less. So less microconidia are present. So how to easily remember? Trichophyton, tricho has maximum tissue involvement and maximum microconidia. And microsporum, micro means less, that means it has less microconidia. Epidermophyton has absent. So pehla point ye hua, that's how you're supposed to identify them. Next, macroconidia. Macroconidia, just look at the shapes over here. One is pencil shaped. Okay, one of them is the pencil shaped. Next, it is the club shaped and spindle or boat shaped. Okay, spindle or the boat shaped. So this one are described as boat shaped ones. Okay, spindle or boat shape. This is the feature of microsporum. Okay. Next, trichophyton, if you notice, this is described as a pencil. Okay. And these ones are described as the club shaped ones. Club shaped ones. So basically, this is something that you should all be looking at. That's about that. This is quite important for the examination purpose. Please make sure you're all learning this. तो याद है सबको hint एक बार let's all say this together final time. Trichophyton, maximum tissue, maximum microconidia. Okay. Microsporum, few, because the word tells you micro means small or less. Epidermophyton, absent. Okay. Next, let's all look here. Subcutaneous fungal infections. Subcutaneous means below the skin. These guys will either produce abscess or sinus that will drain with pus. So that's a basic idea. Now everybody knows this is the disease mycetoma or Madurai foot in this. See, what you need to know, this topic, the Madurai foot, it is caused by bacteria also, fungi also. The bacterial cause of this is known as actinomycotic mycetoma. And if fungi causes it, it's called as eumycotic mycetoma. Okay, so how did the name actinomycotic come? Because of the bacteria called as actinomyces. And in fact, although it says actinomyces, there's another one, nocardia also. Actinomyces and nocardia, these are the bacteria to do this thing as such. Okay, and Madurai name would be seen in majority of them. Now, what you're going to do is, once you all examine this picture, let's all have a look here. Once all of you see this picture right here, okay, we are going to collect that pus. We'll be collecting that pus. And what we'll be doing after this is we examine the granules in this. We examine the granules in this. If the granules are light color, you should know it is bacterial cause. And if the granules are dark, we should know it is the fungal cause. Okay, so that's something that you should all be knowing here. All right, so that's about that. All right, guys. So this was mycetoma that you just saw, Madurai foot. Now the next thing, sporotrichosis or rose gardener's disease, important for questions again. All right. Pretty much every subcutaneous have come in your examination. They have always asked this. Sporotrichosis, rose gardener's disease, rose gardener's disease. Now, you all know it comes by thorn prick. And what ends up happening is, I have told you it presents with ulcer at the site of the trauma. If you get a thorn prick here, you get this, ulcer, but the ulcer doesn't stop there. It starts continuing in the line of lymphatic drainage, right? That's the identification. And this is followed by this asteroid body that becomes important for identification of this guy, asteroid body. Okay. Next, moving on to rhinosporidiosis, one word, it is going to produce what? This thing, what you're looking at, that is strawberry or mulberry-like polypoidal mass. Okay, that's about rhinosporidiosis. Just a quick recap. Mycetoma is mycetoma, bacterial cause and the fungal cause. Bacterial cause is known as actinomycotic mycetoma. Fungal cause is known as eumycotic mycetoma. Next, you should know rhinosporidiosis. This is the one presenting with this strawberry or mulberry-like polypoidal mass. This is not considered to be a fungus anymore. It is an aquatic protist. That's why you get this disease by coming in contact with seawater. Done? Next part. Another what we just studied, rose gardener's disease. You should know the ulcer will start spreading along the line of lymphatics, asteroid bodies, the keyword. Last, subcutaneous infection in this, chromoblastomycosis. Chromoblastomycosis, all of you should know, it produces this wart-like lesions, HPV. You might all know, right? Human papilloma virus, it produces this warts. So this also produces wart-like lesions only, pretty much similar. The very important bodies in this topic is sclerotic bodies. As I told you, it was a previous MCQ in your exam. Just last exam, they've asked this. Sclerotic bodies that has copper penny appearance. Okay, that has the copper penny appearance. Next is the list of dimorphic fungi. As you see, once again, last time, two forms. They exist in yeast and the mold forms. Dimorphic fungi, they are endemic in the American continent, but the one that can be seen even in India, the name is histoplasma. Okay, the one we see in India also, it is known by the name of histoplasma. All right, so this is the thing. Next, the general concept in all of them is they are acquired by inhalation of spores and they present as pulmonary infections. Okay, inhalation of spores and they present as what? Pulmonary infections. This is something that you should know. And just see here, this is how you're going to identify them. This is the spherule filled with endospore seen in coccidiomycosis. Try to remember it like that. It's seen in what? Coccidiomycosis. CO, like that, coccidiomycosis, spherule filled with endospores. Spherule means something round filled with spores. That's it. Okay. Next one, this is the guy that is known as broad-based bud. Okay, this is described as broad-based bud. Routinely, the budding should look like this. Yes or no? The bud is small, but here you can see it is very broad-based bud. Okay. Now try and understand this thing. When I'm saying broad-based bud, if this looks like the letter B to you, I know it's more like number 8, but letter B, imagine it like this. It is seen with blastomyces. Okay. This one would be seen with the organism called as blastomyces. Then you know these two, Mickey Mouse appearance and this one, that is Captain Wheel appearance, they are seen with paracoccidiomycosis. I'm going to show you the picture. I would want you to say what this is seen in. I hope you said coccidiomycosis. This was the hint, coccidiomycosis. What is this one seen in? Super easy, blastomyces. Next, this one, Mickey Mouse and this Captain Wheel. This is seen in which guy? This is seen in the paracoccidiomycosis. Okay, so that's about that you should all know. Okay, next, coming to this guy, opportunistic fungal infections. First one is Candida. Candida, anything when you learn about it, it is described as white colored lesions which are described to be curd or cheese-like. Okay, curd or cheese-like lesions. Okay, so that's your Candida. curd or cheese-like lesions. Now, the white word comes from the most common species called as albicans, where alba means white. Okay, alba simply means white. Since we are talking opportunistic word, now you will definitely have to learn some situations when these infections can come. General things. It's not very complicated that you have to memorize. Immunocompromised patients like natural disease HIV or by using drugs called as steroids. Okay. Main things. Now, please pay attention. Mucocutaneous lesions of Candida are super high yield. And you should be knowing here, mucocutaneous lesions, you have oropharyngeal candidiasis that produces oral thrush. This guy is producing what? Oral thrush. In the mouth, you will see this white color, cheese-like layer. Vulvovaginal candidiasis presents with this discharge, which is again described to be curd-like. And very important, esophageal or tracheal candidiasis seen in HIV patients. Esophageal or tracheal is seen mainly in the HIV patients only. Okay. The buds, they take up the shape of hyphae. So they're described as what? Pseudo hyphae formation. What is the story? They don't detach themselves from the parent. Hence, they keep forming a line like this, which ends up looking like hyphae known as pseudo hyphae. So pseudo hyphae formation. Okay. Next is Reynolds Broad test or the germ tube test. Germ tube test. Okay, that is an important keyword you should remember here. Appearance looked like one of the germ cells, that is sperm. Okay, it looks like a sperm. This kind of a appearance, it is the germ tube test. Okay. Next, beta D glucan assay, Candida aspergillus pneumocystis. Candida aspergillus and pneumocystis. Only with 3 infections, the beta D glucan test will come positive. Mucormycosis, etc., the test will come negative because they don't have beta D glucan. Mucormycosis would be negative, whereas the other 3, Candida aspergillus pneumocystis, they would be positive. Okay. Next, you have these 2 infections that happen in HIV. What are these infections that happen in HIV? First of all, learn. What is the CD4 count at which you see this? Less than 200. You see these guys on the CD4 count of less than 200. Less than 200. So know these things. Cryptococcus neoformans, pneumocystis jirovecii. Pneumo means pneumonia. It causes pneumonia in the HIV positive patients, and cryptococcus causes meningitis in HIV patients. So both of them come when the CD4 count is less than 200, one causing pneumonia, one causing meningitis. But only one of them, it will show positivity to some stain, that is India ink stain. Cryptococcus is the guy that is positive for India ink stain. All right. Now I'm just going to brush up on this picture for all of you. One of a very important image that everybody should be comfortable with. This is that image. Okay. Now what you're comparing are the 2 molds, the ones that produce hyphae. Molds produce hyphae. Molds are the ones to produce hyphae. There are 2 organisms that we are seeing right now, Aspergillus and Mucor. Aspergillus and then the Mucor. These are the guys that we are seeing here. Okay. Now, once you are thorough here, Aspergillus and Mucor, pay attention. Mucor is the one producing aseptate hyphae. Mucor is producing aseptate hyphae. All right. And you should know there are no lines seen here. That's why they're called as aseptate. If there were lines present like this, I would have called it as septate hyphae, but there are no lines present. That's why we call it as the aseptate hyphae. Okay. They tend to form this branching at 90-degree angle, as you see. Next, look at this thing, septate hyphae, narrow septate hyphae. This is the feature of, this organism, what we are calling as Aspergillus. 45-degree angle, aspergillus like this. आप सबको याद होगा, to identify this, I have told you to do this thing. A for aspergillus, turn it around like this. 45-degree branching angle you will get. A for aspergillus, 45-degree branching angle. And if you look at your fingers right now, they will all have septate. That's the easy way to remember this. Okay. Aspergillus is the one with a 45 degrees and it has that septate. Okay. That's done. Next, this finishes your mycology. Let's move to parasitology next. Now keep watching. Parasites, they have these things. First one, please know all of you, parasites are divided into protozoa topic and the helminths topic. Protozoa and then the helminths topic. Now what you're supposed to know, helminths are the worms, as you can see. Now, just keep saying these names. There are two stages that you see with protozoa. Generally speaking, trophozoite and then the cyst. Trophozoite and then the cyst. These are the things that you need to know as such. Trophozoite and then the cyst. All right. Now, see here. First, we have three diarrheal agents. Infective stage of all the three diarrheal agents, it is cyst. So how do these diarrhea come inside your body? If I ask you, they come in the form of cyst. First, entamoeba histolytica. Entamoeba histolytica, or simply entamoeba, causes bloody diarrhea called as amoebic dysentery. Bloody diarrhea, entamoeba. The lesion of this is described to be inverted flower-shaped ulcer, like this. It is described to be inverted flower-shaped ulcer filled with pus known as anchovy sauce. Now, what are you going to do for any diarrhea to diagnose it? Collect the stool sample. And what are you expecting to find in the stool sample? The organism in its various stages. Let it be cyst or the trophozoite. Now, the cyst of Giardia as well as entamoeba. Okay, two organisms, Giardia and entamoeba. It is described as quadranucleate cyst. 4 nuclei, quadranucleate cyst. Okay, so that's understood by all of you. Next, Giardia lamblia, again the same story. Quadranucleate cyst comes inside us, but this time the diarrhea is fatty diarrhea, right? Steatorrhea. Entamoeba is a bloody diarrhea. Giardia is a steatorrhea. Diagnosis wise, please just look here. It produces falling leaf motility. This is the guy that you need to look at. Identify that this is Giardia trophozoite. It produces this falling leaf motility. Okay. Next, Cryptosporidium isospora cyclospora. Cryptosporidium isospora cyclospora, they cause diarrhea in HIV patients. All right. And you can see here, the cyst of these guys are pink in color. That's why they're called as acid-fast cyst. Okay. They're called as the acid-fast cyst. Next. So a quick recap for all of you. What did you learn earlier? I just said entamoeba, giardia, and the HIV diarrheal agents. 3 different ones, right? Who amongst them are going to appear pink? The cyst of which are pink in color, the diarrheal agents in HIV. Okay. Next, who amongst them has a human face like trophozoite? It was giardia. And quadranucleate cyst is seen with both entamoeba also, giardia also, right? Next organism, Trichomonas vaginalis. This is the organism. See, 2 stages I have been mentioning, either trophozoite or cyst, right? But this guy does not have a cyst stage. Okay, this one doesn't have a cyst stage. It only has the trophozoite stage. And these trophozoites are sexually transmitted. Okay, so it has only trophozoite stage, which are sexually transmitted. Okay, next. It causes trichomoniasis disease. Of course, everybody knows this. It produces a discharge. And on the colposcopy, you get to see the strawberry cervix. Okay. Next, let's move from here. Just a quick overview. Leishmania and trypanosoma. What you should know? If I say Leishmania donovani, when it comes into human body, which form does it enter as, or which stage is the infective stage? The answer is promastigote. Leishmania donovani comes inside our body as promastigote. Is that understood by all of you? Now, once it comes inside, guys, it is going to cause the disease called as Kala Azar. Kala Azar. So, Leishmania donovani causes Kala Azar, but how exactly? Somebody gives you that infection called as sand fly. Sand fly is going to give you that infection. Is that understood by all of you? Now, Kala Azar is called Kala Azar because of the dark pigmentation that you see here. Okay, so this is your Kala Azar word, dark pigmentation that you see. All right. Next, what you should be knowing here is clinical features wise, this is the guy that is going to have this ascites, massive abdominal swelling. And when you palpate, you're going to examine a mass in here. You will see a mass as such in this person. Okay, two words that you're supposed to remember here. RK39 antigen. RK39 antigen. This is one test. Okay, card test, RK39 antigen test. And second is LD bodies for confirmation. RK39 test and then the LD bodies. LD body is initials you can remember for Leishmania donovani. So what is the LD body? This word kinetoplast would be important, right? If you're mentioned by this word kinetoplast, no, it is the LD body of Kala Azar. So basically, this is a macrophage inside which you're seeing the organism, one of the parts called as kinetoplast. Okay, so that's about this guy. Next, just one line, Trypanosoma cruzi, Trypanosoma brucei, what you're supposed to know. Guys, cruzi causes Chagas disease, spread by reduvid bug. Trypanosoma cruzi causes Chagas disease by reduvid bug. Okay. Next, Trypanosoma brucei causes sleeping sickness, spread by CC fly. Spread by the CC fly. Sleeping sickness spread by the CC fly. Okay, so that's about the hemoflagellates. Now, one topic you can't miss out at all. You can see here, basically, this is the topic called as malaria. Now, infective stages, etc., you can understand in some time. Just know as a recap, in parasitology, if you see the word definitive host, see, first of all, parasite needs host for their survival, yes or no? That's why they're called as parasite. Without host, they can't survive. So definitive host is that host for the parasite in which it completes its sexual cycle. And intermediate host is that one in which it completes the asexual cycle. Okay, are these two words clear? So in one of them, it basically controls the sexual cycle, and in the other, asexual one. That's how the names are, definitive and the intermediate host. For the malaria topic, the mosquito is the definitive host. That means sexual cycle takes place in the mosquito, whereas intermediate host for this is man. Human being is the intermediate host. Now you should be knowing Plasmodium, it performs its life cycle. It performs its life cycle in two places. One is in the liver, second is in the RBC. Since RBC is the main cycle, the word is erythrocytic. And since it's an asexual cycle, the word is schizogony. Erythrocytic schizogony. Is that understood by all of you? Erythrocytic schizogony. This is the word that you should all know. Next, what do you think the liver cycle is called as? Pre-erythrocytic schizogony. Before the RBC, hence the name is what? Pre-erythrocytic schizogony. So you have erythrocytic and the pre-erythrocytic schizogony. Now listen to me very, very carefully. When a mosquito bites, it will bite you. Okay, imagine here. Now, through the bloodstream, the form of the malaria that was left in your body will reach the liver, right? What is that form? Sporozoite. Keep saying the names. Sporozoite within minutes migrates to the liver. S for the sporozoite. In the liver, the sporozoites convert to one form called as merozoites, right? It converts to merozoites. All of you have the cycle written. So merozoites. This is happening in all the species. The merozoites will now come to the blood. They will multiply in the RBC. That's your erythrocytic schizophrenia. Merozoites were formed in the liver and now they come to the blood, right? In the blood, they keep multiplying. They keep multiplying. This is all happening inside the RBCs. I hope everybody is comfortable. But meanwhile, I told you one more stage will form inside the RBC called as trophozoite. Trophozoite. Trophozoite is the one that takes the shape of a ring. We are going to see this coming up later. It takes the shape of a ring. Is that understood by all of you? Now, that's the main things that you should be knowing here. And one more form that would be formed in the blood, it is known as the gametocyte. So, chalo, phir se ek baar. Mosquito bit me, it left the sporozoite. Sporozoite went to my liver. In the liver, what is happening is that the sporozoite migrates to or converts to a form called as merozoite. Then merozoites have to multiply. Where are they multiplying? RBC mein. And in the RBC, one extra stage will form called as the trophozoite also. I hope this is understood by all of you. Then what is the story is, doctors? Once this guy is out from there, they keep rupturing the RBCs every 2 days. See how much time it's taking for them to fill up this entire RBC with merozoites and finally the RBC rupture? 2 days, at least for the species seen in India. That's why the fever keeps coming every third day. Then the name given to this malaria fever is tertian fever. That's why it's called as what? Tertian fever. Is that understood by all of you? Okay. Now, by now you must have understood merozoites are the one producing symptoms of malaria. Next, another form is formed in the blood and it's kept as such. It cannot continue the cycle. That is called as gametocyte stage. Gametocytes are formed, but they cannot continue the cycle in human beings, right? So that is something that you should all be knowing as such. Okay, everybody comfortable with what I said? Next, let's move forward. Now, there are two species called as vivax and ovale. Vivax and ovale, what they do is in the liver, they form one extra stage called as hypnozoite. Hypnozoites, they sleep for a few years, that is 2 to 3 years, before they wake up and restart malaria. That restarting the malaria is called as relapse, right? That is known as the relapse of malaria. So basically, these are all the stages you are seeing here. And the importance you will know. RBC contains merozoites. They are producing the symptoms basically. Yes or no? Hypnozoites will cause relapse. Next, coming to this thing, I've already told you relapse is seen with vivax ovale, whereas recrudescence, the drug-resistant parasites are especially falciparum, which can again cause malaria in your body because they might escape your, antibiotics. Now, which people do not get malaria? Okay, which people are immune to malaria? Anybody whose RBCs are defective, they will not get malaria. Example, sickle cell anemia. Normally, the RBC is supposed to be biconcave disc shape. But if it's becoming like a sickle, now that guy called as plasmodium doesn't like your RBC. That's why you are protected. You don't get malaria. Okay. Symptoms of malaria like fever, chills, etc. That's like quite normal to understand. Please know anemia happens because of the direct effect that the RBCs are infected by the parasites and they're rupturing them very frequently. That's why anemia can happen because of this. Next, all the severe things, whatever you see, like shock, CNS involvement, etc. Everything is by one organism, falciparum. That's why we say falciparum is the more severe organism. Amongst all of them, who's the one in the clinical presentation that's going to be very severe? It is falciparum. Okay, so that's about that. Next, we have to take this blood smear, etc., and examine these things. I'm just straightforward going to tell you this once. Have a look at this. If you see this picture, guys, this is known as banana-shaped gametocyte. Okay, banana-shaped gametocyte. This one you should be knowing. Multiple rings within RBC is falciparum. Multiple rings within one RBC, it is falciparum. Whereas one single large ring inside an RBC, it's called as Vivax. That's the identification of Vivax that you can easily do. Okay. So I hope this is understood by all of you. Next, these drugs you should revise later for sure. Okay. Babesia, what you're supposed to know is it causes babesiosis. Babesia causes babesiosis. And this is described as malaria-like disease. Okay, it is a malaria-like disease. It's not malaria because malaria is caused by Plasmodium and spread by the mosquito. Whereas babesia, it looks like malaria in presentation, but it is spread by exodus tick. Okay, and the appearance it shows is described as this Maltese cross appearance. Okay, this would be described as the Maltese cross appearance. So this is something everybody must know. Toxoplasma gondii. Toxoplasma gondii, please remember the main host here is cats. And toxoplasmosis comes under torch infections, what you learn for congenital infections, right? Very important that you learn, right? Toxoplasma. Toxoplasma is one of the congenital infections. Okay, is that clear enough to all of you? Now, listen to me what I'm saying. Toxoplasma gondii, when I'm saying the word, if they want to hint you and ask you about congenital toxo, they will definitely mention cats in the history more or less. Now, what are the identifications you need to keep in mind, doctors? Intracerebral calcifications are seen with two organisms in torch. One is toxo, another is CMV. So toxo and CMV, these are the guys that are going to show the calcifications. Okay, so that's about that. Next, moving to the worms. All of you can have a look at the two types of worms now, flat and the round worms. Flat and the round worms. These are the two types of worms. Round worms are called as nematodes. Round worms are simply called by the name of nematodes, right? So that is something that you should know. Round worms are known as nematodes. Flat worms rather are called as cestodes and the trematodes. Cestodes and then the trematodes. Cestodes are tapeworms which are generally having some animal name. Agar aapko basic bhi yaad hoga, that dog tapeworm, poke tapeworm, like that, you know some animal name is involved. Except for one guy who don't have an animal host, H. nana. H. nana is known as dwarf tapeworm. H. nana simply would be known as what? H. nana would be known as the dwarf tapeworm. So this is the key word that you should not forget. H. nana is the one that is having the name dwarf tapeworm. Remaining all have some animal name. So these are the cestodes, doctors. Next you have trematodes. Trematodes are also called as flukes. Trematodes are also called as flukes. So you have example schistosoma here, right? Example we are seeing schistosoma. Okay. This is known as the blood fluke. Okay. The word here would be simply blood fluke. Chalo, you must have already gotten this idea. Flukes are trematodes. Cestodes are the tapeworms. Starting with the first one, trematodes, they have aquatic hosts. That's why eating raw fish or eating some water plants, aquatic plants, you can get these diseases. All right. Next, coming to this thing, the main guy, Schistosoma hematobium, it produces bladder cancer. We might have learned this before. Yes or no? So hematobium produces what? Bladder cancer. Schistosoma hematobium produces bladder cancer. Next organism, Japonicum and Mansoni, they produce Katayama fever. Japonicum and Mansoni, they are producing Katayama fever. So that's about that you should be knowing as such here. Okay. Next, if you examine the eggs, सबसे पहले I'll show you one egg. I would want you to pay attention to this egg. See here, doctors. This egg is described as operculated egg. Remember this word? Operculum means opening. So operculated egg is this egg, and this is the egg of trematode. That means trematode egg should have one opening. Trematode's egg should have had a opening. That is called as what type of egg? Trematode egg, operculated. Whereas one trematode doesn't have the opening. That guy is schistosoma. It's an exception. So schistosoma, what you need to know is schistosomes have non-operculated egg. There is no opening in them. Then how to identify? How should you know if there is no opening, etc.? This is by looking at certain things called as spine or knob. Okay. Now, knob is present in Japonicum. I'm sure you're all giggling right now if you remember this. Next, Mansoni looks like a man. So this is Mansoni lateral spine, and the terminal spine is in hematobium. Hematobium. So Japonicum, Mansoni, and hematobium. Hematobium. This is the word that you need to remember. Next, let's continue. So you have already seen the eggs of a trematode. Trematode egg is operculated egg. Next, coming to the cestode topic. Cestode may everybody should know how to identify Tinea solium. I'm going to show you this picture once again. Everybody look here. Now, these are worms that you can look at already. One of them has this teeth-like structure called as the hooks. If you see this, identify it's Tinea solium. If it's not there, then that is Saginata, right? If it's neat and clean, right, then it is Saginata. Have we learned it like this? Saja hua, more clean, right? So this is the one that is ready. So we have said that is Saginata. Okay. Why should you know all this? Look here. Taking you back, this is the egg of a cestode. Okay, pay attention. This is the egg of a cestode. How to identify this? This guy has 3 pairs of hooklets like this. It will have 3 pairs of hooklets that you can see here. This is the egg of a cestode. Okay. So how was the egg of a trematode? Trematode egg was simply, having this opening called as operculum, operculated egg. And then cestode egg is this one. Okay, quite easy to identify. Now, if that's comfortable with everyone, now let's see. Larvae, the larval forms in the tinea are called as cysticercus, and that's how the name neurocysticercosis came, based on the larvae over here. Next is the cysticercoid larvae. Cysticercoid larvae. Now pay attention. This is in Hymenolopus, but that's not very important. Rather, I would want you to learn hydatid cyst for the organism Echinococcus. So hydatid cyst disease, very easy to be identified as soon as you see it, right? What is this disease here? Hydatid cyst disease. Okay. Echinococcus or the dog tapeworm causes this. Echinococcus or the dog tapeworm causes this disease called as hydatid cyst disease. You can very easily see the cyst. It's a dog tapeworm. And one very important test association here is Cassoni's test, which is an example of type 1 hypersensitivity. Cassoni's test is an example of type 1 hypersensitivity reaction. Okay, so that's about it that you need to know with this. याद होगा आपको mnemonic. There is Cassoni's test that is done for the dog tapeworm, also called as echinococcus, right? And these guys, they cause hydatid cyst disease. Okay. Next, who causes neurocysticercosis? Tinea solium. Tinea solium. And the point you should underline and recall is you don't get neurocysticercosis only if you eat pork. You can get it by ingestion of eggs which are present in contaminated food and water. So even a strict vegetarian can develop this disease, neurocysticercosis. Now, this is a very important cause of seizures in India. Okay, it's a very important cause of seizures in India. All right. Dilatum is the fish tapeworm, you should know, causing megaloblastic anemia. Okay. Dilatum is the fish tapeworm causing that megaloblastic anemia. Next, we have this dude. As you can see very clearly here, okay, you're seeing the word right now, that is this egg. Just look at this egg. Are you able to notice this 3 pairs of hooklets? The answer is yes. You're able to see the 3 pairs of hooklets. And then are you able to see this polar filaments? Yes, the thickenings like this. If you see this thing, the mnemonic in Hindi was Nana Ji ka chashma. It's like the grandfather is wearing the specs. Nana, Nana. Nana is the name for grandparent, right? So Nana Ji ka chashma. That's how we had learned this thing. So if you just see that extra thing swellings, then you should confirmatively know that they're talking about this organism. Okay, is that understood by all of you doctors? Next topic is roundworms. Chalo, before we go to the roundworms, what are the 2 names of the flatworms? One is the trematode. Trematode is the one that is called as a fluke. T is trematode, it is fluke. And then you have cestode or the tapeworm. Cestode or the tapeworm. Nematodes, as the name says, these are the roundworms. Now, what you have to remember in them, some of these roundworms you get by ingestion of eggs. What is that mnemonic? Eat. So who comes under this? The organisms like Enterobius, okay? Organism like Enterobius, and here Strongyloides. Strongyloides. याद है आपको ये mnemonic sand? These organisms come through your feet. Are you understanding this? They enter through your feet, causing this condition called as cutaneous larva migrans. So these are the worms entering through the feet, causing what condition? Cutaneous larva migrans. That is the mnemonic called as sand right now. Okay. So cutaneous larva migrans, this is the mnemonic sand as such. Okay. Now that this is over, look at this. Let's start. Enterobius vermicularis. Enterobius vermicularis. This most commonly causes perianal itching in children. It causes perianal itching in children. So itching around the anal area. So this is the egg that is described to have the tadpole-shaped larva shape. So do you see this outline, what I'm drawing right now? Just have a look at this. If I remove it, that shape you might be seeing, I don't know now or not, that is the tadpole-shaped larva. You have to look for this line that is there in between, this one that is splitting it. That is your tadpole-shaped larva. Okay. Next, moving on, this thing must be bringing memories. Trichuris causes rectal prolapse. Okay, trichuris causes rectal prolapse. And we said that proctoscopy, right, shows this appearance, what is described as coconut cake rectum, right? It produces that coconut cake rectum. You have to just recall this thing. The shape of the egg here. The shape of the egg here is barrel shaped egg or the dumbbell shaped egg. Okay. Roughly speaking, these are the outlines that you need to know. See this constriction like this. This is the guy that is giving the dumbbell shape like this. Dumbbell shaped egg or barrel shaped egg, right? Mnemonic, if you lift two heavy dumbbells, you get a rectal prolapse. So dumbbell shape is causing the rectal prolapse. Okay. Next, moving on. This eggs also, at least you should know to identify. These are the eggs of Ascaris. Okay, these are the eggs of the parasite called as Ascaris. Last and the final, Necator and Ancylostoma. Okay, Necator and then Ancylostoma. Both of them are called as hookworms. Why did they gain their name like that? Hookworms. They hook onto the RBC, thus they suck the iron out of it, as I told you. That's why they are simply called as the hookworms. Okay. Is that understood by all of you? So they suck the blood out of, the RBCs. That's why what ends up happening, you develop iron deficiency anemia. Okay. So that's about that you should be knowing as such in this topic. Okay. So this finishes your parasites as well. Just a quick recap. Parasites are divided into two things. One is protozoa, another is the worms. Worms के two types हैं. What are the two types of worms? Flatworms, cestode and the trematode. And then next is this roundworms, what you just saw with the respective eggs, etc. Okay. So that's about this guy that you should be familiar with. Okay.